Nancy Cavey, National Individual Disability and ERISA Disability Attorney. Welcome to Winning Isn't Easy. Before we get started, I've got to give you a legal disclaimer. This podcast is not legal advice. The Florida Bar Association says I have to tell you that, so now I've said it. I want to let you know that nothing will ever prevent me from giving you an easy-to-understand overview of the disability insurance world, games the carriers play, and what you need to know to get the disability benefits you deserve. So off we go. Today, I'm going to be comparing and contrasting the obligations of receiving medical treatment in an ERISA and Social Security disability claim. And I'm going to be walking you through the 5 medically based tips and factors that I think are important for you to stay on track in your claim, regardless of whether or not it's ERISA or Social Security disability. So in essence, what I'm going to be talking about first is comparing and contrasting your obligation to get medical treatment in an ERISA disability claim and a Social Security disability claim. Second, I'm going to talk about what are the 5 things that you have to do to stay on claim and be paid in your ERISA disability claim. And then lastly, what are the 5 factors that have to be met before the Social Security Administration has to give your treating physician's opinions controlling weight in your Social Security disability claim? Got it? Now, before we dive into this topic, which I think is very important because most people who have an ERISA claim also have a Social Security claim, let's just take a break, and then we're going to come back and dive into this. Get out some note paper because I'm going to be giving you some very important tips and food for thought. All right. See you in a minute. Welcome back. Let's talk about comparing and contrasting your obligation to get medical treatment in an ERISA disability claim with your obligation in a Social Security disability claim. Now, before we took our break, I alluded to the fact that many ERISA insurance policies or plans require that you get reasonable and appropriate medical treatment as a condition of continuing to get your monthly long-term disability benefits. Now, additionally, these policies require that you apply for Social Security disability benefits. So we have 2 obligations that you have on a contractual basis that if you don't comply with, gives potentially the disability insurance carrier an easy win because they can deny your claim for a breach of those obligations, contractual obligations, before they even get to the question of whether or not you meet the standard of disability. So, is the obligation to get medical treatment in an ERISA case the same as it is in a Social Security disability claim? Now, I'm going to start out by talking about Social Security because Social Security will rarely deny a claim on the basis that the applicant failed to follow prescribed treatment and therefore is not disabled. But poor compliance with medical instruction will be used by claims examiners at the initial application and the request for reconsideration level, and even judges when they're making credibility determinations. That credibility determination based on your noncompliance with medical treatment can result in claims denials. So why is that? Well, many times claims examiners or the judge will reason that you must not be as disabled as you claim you are. Otherwise, you would have followed the prescribed treatment, and they will find that you're not believable. In other words, if you're in so much pain and you can't work, then you would have been compliant with the medical treatment. And therefore, the judge will say, I just don't believe you, or I'm not going to give significant weight to your complaints. Now, the Social Security Administration has regulations that will address that issue. In fact, there is Social Security ruling 967P, and it deals with the failure to follow prescribed medical treatment. And it suggests that your statement about your symptoms and your functionality can be less credible if the level of frequency of treatments is inconsistent with the level of your complaints, or if the medical reports or records show that you're not following the treatment as prescribed. And there are no good reasons for this failure. The ruling suggests that a claims adjudicator or a judge shouldn't draw any inferences about your symptoms and functionality without first considering any explanation that you might offer or any other information in the case record that would explain this infrequent or irregular medical visits or the failure to, comply with treatment. Social Security Regulation 967P requires that the claims examiner ask if there's some good reasons why you haven't been seeking that medical treatment. So what are those acceptable reasons for not being fully compliant in a Social Security case? Well, one of the reasons is that your daily activities of life are so structured by you to minimize your symptoms. So in other words, you are moderating or just doing things, if you will, in a way that's structured to minimize your symptoms. So, for example, you may not be cleaning the house every day. In fact, you may only be able to wipe down the kitchen counters. And the fact that you are modifying your activity, your daily activity, to minimize your symptoms is a factor. Now, also, another reason what might be is the symptoms may not be severe enough to prevent you from seeking ongoing medical treatment because you can relieve those symptoms with over-the-counter medication. And I will tell you, I don't like that particular rationale because then the judges will say, well, my goodness, if your symptoms can be relieved with over-the-counter medication, then you ought to be able to work. Another reason might be that you're not taking the prescription medication because the side effects are less tolerable than the symptoms. In other words, the medication might make you sick. It might make you drowsy. It may make you feel worse than your actual symptoms. And that's something, of course, obviously would have to be in your medical records. And of course, one of the common reasons I hear is that you can't afford the treatment, or you may not have access to free or low cost medical services. That might be the case, but I think, again, in your medical records, you should be documenting the fact that you don't have insurance or the difficulty you're having paying for the medical treatment that you're getting. And as a result, you're rationing your care. In other words, you're not seeing the doctor as frequently because you would rather save that money to spend it on the medication the doctor's prescribing. Another good reason is that you may have been advised that there's no further effective treatment that can be prescribed that would benefit them. Now, that's a good reason and a bad reason. What do I mean by that? If, for example, you have a spine issue and you have been prescribed physical therapy, but you can no longer afford the physical therapy, it would be helpful that you are getting physical therapy at home. In other words, you're doing home exercises. And even if you may be getting minimal benefit from it, I will tell you that judges expect that you are doing some sort of self-care, if you will, to help minimize your symptoms. And of course, another reason might be that the treatment might be contrary to the teaching and tenets of your particular religion, or you may have undergone multiple surgeries without success, and you're reluctant to undergo repeat surgeries. That's one that does resonate with the judges. And again, just because the treatment has been recommended, the surgery's been recommended, the judge doesn't necessarily, or Social Security, expect that you will have that surgery, but they do expect in the medical records an explanation as to why you don't want the surgery or repeat surgery and what treatment you are in fact getting that helps modulate or reduce your pain. Now, another reason, and I hear this all the time, is that the treatment might be significant and could result in your death, like open heart surgery. Now, that's a very risky surgery. Organ transplants are risky surgeries. So if there is a significant risk involved with the medical procedure, again, that can be a good reason for not getting that treatment, but you've got to document that. And of course, if the treatment involves something like amputation, the Social Security Administration isn't going to require that you have an amputation. And one of the final reasons would be that the impact of having treatment could result in a greater impairment. So what do I mean by that? So let's say you've got cataracts in one eye, let's say the right eye, and you're blind in the left. If you have surgery on that cataract that's not successful, you would obviously be blind. So again, these are just some of the few reasons that the Social Security Administration or the judge will look at and potentially excuse either the lack of treatment or the frequency of the treatment. But I'll tell you, if the claims examiner or the judge finds that there's no credible explanation as to why you're not compliant, you're going to see, as I said, a claims denial based on the lack of your credibility. Those denials are really hard to appeal, particularly one in which the judge has found that the nature of your symptoms, the intensity of your symptoms, the frequency of your symptoms is just not consistent, or is the result of your non-compliance, and then ultimately says, I just don't believe the applicant. Now, on the other hand, if there's a credible explanation as to why you are not compliant, that should be addressed in your medical records. Just because you say this or that doesn't necessarily mean that the judge is going to accept what you have to say about what your doctor said. So make sure that your doctor is documenting the reasons why you may not be compliant with medical care. That will help with that particular issue. Now, will the ERISA disability carrier take the same approach? Heck no. Disability insurance claims are month to month, and therefore the disability carrier expects that you'll be getting medical care with a frequency and a level of care consistent with your claimed disability. So let's compare and contrast. Daily activities are structured to minimize your symptoms. And so what the carrier is going to say, again, much like Social Security, if you can minimize your daily activities or structure them in such a fashion that reduces your pain, you can work. Symptoms may not be severe enough to prompt you to get ongoing medical treatment or attention, or it can be relieved with over-the-counter medication. No treatment is a violation of the terms of many disability insurance policies or plans, even if the symptoms can be relieved with over-the-counter medication. And they'll say, well, no reason why you can't work. The applicant may not take prescribed medication because the side effects are less tolerable. Now, the carrier may suggest that there's other medication that you could take that has no or little side effects that would allow you to work. And I see that often. If you're having that particular issue, you want to make sure it's addressed with your doctor, and your doctor is doing different trials of medication, noting to the degree to which that medication may or may not have been successful. The other reason, applicant may not be able to afford treatment or doesn't have access to low-cost care. Carrier is going to say, too bad, so sad. The policy requires that you get medical treatment. So go get the medical treatment. If you got to go to the health department, well, we'll consider it. But if you get no medical treatment, we definitely will deny this claim since you're non-compliant. How about the argument that you've been advised that there's no further effective treatment that can be prescribed that will benefit you? The carrier's argument is there's always some form of treatment that you should be getting, even if it doesn't necessarily benefit you. And I know that sounds crazy. It sort of goes back to the you should be doing something approach to treatment. So see the doctor, once every couple months, tell them what you've been doing in terms of activities of daily living, the way you've tried to modulate your activity, the fact that you're still having pain, and the fact that you're still trying to be compliant with their recommendations, including home exercise care. But again, that's a slippery slope. I've never had this arise in the context of an ERISA case. The argument that the treatment is contrary to the teaching or tenets of an individual's religion. But I would presume that the carrier would say that notwithstanding the tenets of your religion, you still have an obligation to get treatment, and there is certainly an alternative to that treatment that would not violate your religious teachings or the tenets of your religion. The applicant may have undergone surgery with unsuccessful results, and you're reluctant to undergo surgery. Well, that will only go so far. I mean, the courts recognize that you don't have to have surgery. You can't be forced to have surgery. But even the courts will expect that you're getting some form of conservative care in the form of therapies, medications, or injections. Of the argument that the treatment might have significant complications is one that the courts do recognize. But again, the courts are going to expect that you exhaust all conservative treatment, or they'll say you are non-compliant with the terms of the policy. Well, how about the amputation issue, for example? I think the carrier would accept that explanation, but again, they're still going to expect conservative treatment, including injections and the use of pain medication and therapy. How about that argument that the consequences of a surgical procedure could be catastrophic? You have that cataract surgery, and if you lose the vision in that eye, you're blind. Well, I see the carriers twist that one around, and they'll say, aren't you sure there aren't assistive devices that would help you, for example, with your vision? And again, if you find yourself in any of these situations where you've got a question about what your policy says about the nature of the medical care, the frequency or duration, and you're faced with these practical problems, you need the advice of an experienced ERISA disability attorney, because the carrier or plan can be very inflexible when it comes to that requirement. Many times I'm trying to negotiate a compromise, if you will, with the carrier about what it is our client is expected to get under the terms of the policy and what realistically they can get in view of some of these complications. Now, that was a lot of information. I'm going to take a break and let you digest that, and we'll be back in a second.